China is reaching out to many countries in Africa and elsewhere where the experiences of the experts is now being shared, and WHO also serves as a means of making connection across countries.
This is one of the things that I'm very keen for WHO's leadership, that we could all be working as an entire UN family, really towards the vision that this country has for a healthy China. Hello, my name is Siddharth Chatterjee, the United Nations Resident Coordinator in China, and welcome to Delivering as One, a UN in China conversation. In this podcast, we highlight the heads of UN agencies in China who shape our diversity, discover their motivations, and find out about their work here on the ground. Today, I'm delighted to be joined by Dr. Gauden Galea, the World Health Organization representative in China. Dr. Galea is a Maltese national, joined the United Nations in China in 2018. Gauden, welcome to Delivering as One.
Thank you. It's good to be here.
So let's get started, Gauden. Tell us about your early life, growing up, your studies, and your early career.
You have already said, Sid, that I am a Maltese national, and I immediately have to start with the fact of being so humbled by the origins from such a small country, a small island, and working in the China, which is 1.4 billion population, vast land and with great influence in global health. And I have to say that every day in my job, I feel the honor and the privilege to be in this context, coming from my own origins. I'm a physician by training, and when I started in public health, it was a natural move for many reasons. I highlight, though, one point in my early career. In 1986, I was invited to my first international meeting in Ottawa, and that meeting produced something called the Ottawa Charter on Health Promotion. And I can basically say that it was a turning point in my career. Having been fairly technically trained in epidemiology and in medicine, I was suddenly switched on to the idea of global development, of global health, of enabling and empowerment. There was a new language that was coming into medicine and health, and I was turned on to public health, population health, and health promotion ever since. And there's much more to say. In my early career, I had two big tasks in my home country. One, to set up and lead a health promotion department that is still very much part of the Ministry of Health there, as well as to be the first executive director of what has now become the Faculty of Health Sciences in the National University. So both of these prepared me very well for the tasks of international health that I have been pursuing ever since.
Fantastic. So tell us, how did you eventually come to work with the United Nations in China? I mean, what kind of prompted that?
It's been a circuitous route. I started with WHO 24 years ago, almost 24 years. I have my 24th anniversary in June of this year. So it's been a journey of many countries and many levels. I started in Fiji, in Suva, for a couple of years, worked there as a technical officer on Healthy Islands, a movement of health promotion across whole islands, whole of society settings, and was a great introduction to both Pacific culture as well as to international health work. Then a very rapid summary, a few years in Manila as regional advisor for non-communicable diseases, 4 years in Geneva, where I was coordinator of health promotion, and as a major task was the coordinator of a global conference in health promotion that was held in Nairobi, your old duty station, Sid. Then I moved to Copenhagen, where I was, for the European region, director of non-communicable disease and promoting health through the life course for 7 years, working with the whole of the European region. Some people think that that's just the European Union, but it's far beyond that. That's Western, Eastern, and Central Europe. Yes, 53 member states. But that whole region is still smaller than the country where I have now been hosted since 2018, and that's China, of course, with 1.4 billion people being even bigger than the whole of the region I served for the past 7 years. A thread through all that has been my interest in health promotion and non-communicable diseases, and that's something I bring to China as well.
Fantastic. So, what does your organization do to support the people of China, the country's priorities, and the UN family at large?
So China is undergoing very rapid transitions, and it is not a standard duty station for WHO representative. If one looked at the types of things that WHO representatives do, they, in some areas, in least developed countries, they provide direct services, they're involved in logistics and procurement. That's not something that's relevant to China at this time. With China, we work more on what I could classify as technical support, systems design, and advocacy and communication for health. And maybe if I could give a quick example of each. Under advocacy, we try to reach out to policymakers and the leadership of the country to bring forward areas of population health that could bear improvement. One area, just to give an example, is that of alcohol. China does not, in the general population, does not still understand what a big impact alcohol has on the avoidable burden of disease, and understanding how the alcohol industry works, how marketing is done, how young people are recruited into alcohol, how alcohol is normalized into the life of the Chinese population. That's an area where we can see improvement that can be done, and it is our task to identify such risk factors or conditions of life where improvement can be made, and we bring that to the attention of policymakers and the general public. Of course, in the time of the pandemic, we have a role in risk communication and bringing information from our colleagues at the 3 levels of the organization on developments in the science and in ways of personal protection to the population at large. In system design, a big part of our work has been looking at health system reform and the review. China has completed 10 years of health system reform, and we have been invited by the top leadership of the country to look at the achievements and the challenges of the health system. And we have brought to bear an international group of experts who work closely with a cadre of Chinese experts and institutions and developed an assessment of the progress that has been made with some recommendations for the future. So that's an idea of our work on system design and transformation. And then we also work on technical support in some areas of policy. For example, supporting the development of regulatory capacity for vaccines, medicines, medical devices with the National Medical Products Administration. Overall, for the population at large, we take as our guide the Healthy China 2030 Action Plan, which has some very clear-cut targets that address specific risk factors, specific diseases, and health at specific stages in life. And with the UN, we are very much part of the UN Sustainable Development Cooperation Framework, and what I call the 4 Ps, the people, partnership, planet, and prosperity, are the mantra that we have running through all the work that we do in our country office.
You know, it's so well said, Gauden, and this is one of the things that I'm very keen for WHO's leadership, that we could all be working as an entire UN family, really towards the vision that this country has for a healthy China. And I'm mindful of the fact, in fact, I did an interview before the Winter Olympics, that the challenge of non-communicable diseases, and in particular diabetes and hypertension, is what concerns me as we look at the future trajectory of China becoming more and more prosperous, because from its current $12,500 per capita GDP, it's likely to go to about $25,000 by 2025. We need a healthy China to accompany that prosperous rise. So I think it's very important that we kind of put our heads together and what we can do with the government and with the people to really generate that enthusiasm towards healthy behavior. So completely in this, and really counting on you, Gauden, to help us make that happen. So let's look at beneficiaries. So could you provide some insight on the key beneficiaries of your organization in China?
I would like to answer glibly and say the whole of the population of China, and through that work, the whole population of the world. But maybe I will be a bit more specific. We are a small group. In total, our office is 30 people, and this includes both the technical as well as the administrative staff. And so compared to the challenges that we all face in China, this is a very small group of people. And we are a technical agency. We're not a funding agency. We don't provide direct services. So most of our work is as has been well said before, we are advocates, conveners, enablers rather than providers of support. Having said that, at the provincial level, we currently have in 3 provinces and 2 communities within each a pilot currently underway where we are helping and collaborating with national and provincial governments in the development of models of person-centered integrated care. And I'll have maybe more chance to describe what that means. But fundamentally, we have a vision where most of these chronic conditions and the problems that accompany the aging population are dealt with in the community by well-equipped, well-trained primary healthcare practitioners and centers, and where this care is centered around the need of the person, not around the speciality of a hospital. So we would like to see that the models that are developed in these pilot provinces can eventually be assessed by the National Health Commission and other health authorities and be incorporated into the national health system of the country. But if we look at some of the things that have happened in recent years, just last year we have certified China to be malaria-free. This means that China has, over the past few decades, eliminated a condition that used to affect millions of people in the past, and has shown leadership in the world, not only in contributing artemisinin, which led even to a Nobel Prize for China, but was also one of the first country to be using insecticide-impregnated bed nets. And so China has contributed significantly to that. And this was recognized by an international independent board that assessed the provincial level programs that exist and certified the fact that China has indeed achieved this milestone and this landmark, providing inspiration and models of working for other countries. Through that, we know that China is reaching out to many countries in Africa and elsewhere where the experiences of the experts within China and the institutions that have gained all this experience over these decades is now being shared. And WHO also serves as a means of making connection across countries and across regions, recognizing some of these experts as former collaborating centers of WHO. Another example is that working in the background, but providing concrete information and advice to our colleagues within the health authorities of China, we have helped in the movement to make hepatitis treatment more cheap and more accessible to the population. This is leading to major impacts on the prevalence of hepatitis, and we can look forward to a future where there may be a generation that is free or relatively free of hepatitis, with the ensuing benefits such as major reductions in liver cancer, liver cirrhosis, and other conditions that are consequent, disabling and life-threatening conditions that are consequent on hepatitis. Maybe one more example. People may remember in 2016, the bird's nest draped over with very large banners that declared that Beijing had gone smoke-free. Since then, it's not just Beijing, Shanghai, Shenzhen, Xi'an, and other cities. The smoke-free movement has indeed become a national movement with many cities adopting this. It is part of our advocacy that we would like the whole country to adopt smoke-free legislation and to bring in an effective tobacco control law that would not just be looking at public places being smoke-free, but it would be looking at other things like the pricing, availability, and marketing of tobacco, as well as of electronic nicotine delivery systems, e-cigarettes. So that is a taster of the type of work that we are doing and have done in China. Again, I give examples that may be less visible because the work on COVID is, I think, well known to your audience, and so I don't want it to seem like that is the only thing that WHO is working on. The range goes from road traffic injuries to mental health, from maternal health to immunization and vaccination, the expanded program on immunization. So there's a range of areas of disease control, health systems, and health security that we are working on a day-to-day basis.
Great, Gauden. What an insightful delivery. I think quite clearly, the correlation between good health and an economy is quite evident in China. I think historically, going back to their barefoot doctor system and how the country has really worked on improving its public health systems now. And the fact is that, when you have good health, a nation's economy also starts to emerge. And so what a wise way to kind of put it into perspective. And on the COVID front, I think we have every reason to commend China for a very robust public health response as well, in order to kind of flatten the pandemic curve at the very start of the pandemic. Right. So why don't you identify some of the remaining development challenges faced by China in the coming years, and how WHO as part of the UN family in China will assist China in achievement of the Sustainable Development Goals?
So this is an interesting question, because we are currently asking this of ourselves very directly. We are working with our Chinese colleagues and counterparts across the National Health Commission, but across many institutions in government, in academia, and even other stakeholders. We're gathering opinions, advice, expressions of interest to work on the idea of a country cooperation strategy for the next 5 years. China has defined its long-term vision to 2035 for social and economic development. It has also adopted a Healthy China 2030 action plan. And we ourselves are looking at what is the role of WHO and what are the cooperation opportunities that exist. But also, of course, starting from what are the development challenges that exist. So China has eradicated extreme poverty and adopted the theme of common prosperity going into the future. And that is a theme that is very close to WHO's own for the future vision within the Western Pacific region, where one of the big thematic priorities is reaching the unreached, reaching the vulnerable, disadvantaged populations. There are still important disparities in health between people defined, for example, by gender, and by geography. And these, at least these two dimensions, need to be looked at. And one of my sayings is that in gender inequity, women suffer longer, men die younger. We have two challenges before us. One is to improve the quality of life, the opportunities for health that are available to women, such that they can extend their healthy life expectancy, that they are protected during maternity, that we eliminate the remaining deaths from cervical cancer. And so we look at the specific areas where women are disadvantaged, but also to realize that the cluster of uncontrolled hypertension and diabetes that you mentioned earlier, tobacco, alcohol, the risk-taking behaviors are clustered among men, and we seem to take for granted the fact that men live shorter lives, but many of those years actually could be avoided, could be gained if these risk factors and living conditions were changed. And so these issues that I have mentioned are inequitably distributed between rural and urban, between east and west in the country. So there are important challenges under common prosperity to make more fair the distribution of the health benefits across society. Other development challenges that we are looking at include the challenges of a rapidly aging population. The country is encouraging people to have more children, realizing that it faces a challenge of a sudden lack of the lower productive, younger age population that can contribute to the economic means that are needed to sustain an older population into the future. But also that older population has its own challenges. We can make our cities more age-friendly. So there's the environmental and urban health challenges that we need to face. We need to take head-on the problem of long-term care, of dementia, issues that are going to grow whatever happens because of the fact that the sheer numbers of older populations are growing. Ambient air pollution. WHO estimates that of almost 700,000 premature deaths could be prevented every year in China by 2030 with stronger actions to reduce the high levels of air pollution and to mitigate the health effects of climate change. And we have already spoken about the challenges of chronic disease. All of that while keeping an eye out for the next pandemic. We are suffering untold amounts of tragedies, and both in terms of illness and death under COVID-19. But COVID-19 will not be the last pandemic the world faces. And indeed, it is a wake-up call for all governments to increase their vigilance and preparedness for future pandemics as they arise. We have no guarantee that this is the last one, even that it is the last one in our lifetime. As we work, also we see that China is in transition. So China is transitioning in its economy, already by GDP, the second largest economy. So it's growing fast. It's growing fast in terms of its health system, making moves towards a mature health system that provides person-centered, integrated care. And of course, many other transitions, the transitions in industry with innovation, etc. And there is also a transition in China's own self-perception with regards to global health. I remember a time when I started working with China. My first visit was in 1997. And there was a huge office from WHO actually running some programs within China. That role has diminished as China has developed its own large expertise and extensive network of capable institutions. And to some extent, one of the strategic priorities we see into the future is how WHO, as part of the UN country team, can contribute to China in the world, how China's own contribution to global health, whether it be through the Belt and Road Initiative, through Global Development Initiative, through South-South cooperation, whether it be about contribution to policymaking within the World Health Assembly, or very practical contribution to local production of medicines in Africa. There's a whole area of strategic priority going into the future that is, on the one hand, based on the domestic, on the other hand, based on collaboration at the international and the global level.
Wow. What a insightful and wise way to put it all across, Gauden. I mean, it's quite remarkable. When I look at the entire demographic transition that China is experiencing, and I reckon that perhaps that's why the healthy China is so important. I just wonder sometimes whether the demographic transition is a natural process of the demographic transition that we see all over the world. But perhaps China can also become a model. When I talk about a healthy China, that old does not necessarily mean frailty and ill health. Old and elderly care can actually be elderly health. And we could actually have a strong, robust, healthy elderly population, which can continue to remain productive in many ways. And I'm sure that we could probably find ways forward, given China's own history of, from Tai Chi to their diets to all those things, and whether these things of traditional medicine can be combined with modern medicine and advanced in terms of the demographic transition that we are looking at.
Indeed. I have, for many years of my life, been involved in life course approaches to health promotion. And as soon as you talk about healthy aging, you realize that you can't start there. Healthy aging starts at birth. So the early childhood development determines the optimum brain development of a child. And so it's a sense that if you give that child a boost early in their life, in the first 1,000 days, you give that, let's call it a brain boost, that eventually results in a greater brain development that then would, of course, reduce over time through both internal and environmental factors, but certainly would give that same person later in life a head start when degeneration or degenerative diseases might set in. So that's an example of genetic and environmental factors. But of course, a person who starts smoking early in life is going to find it very difficult to stop, may not even reach old age, and when they do reach old age, are going to have much greater limitation on their lung capacity, not to talk about their heart. And so they will be much more disabled than someone who has never smoked. So healthy aging, to give one last example, when you do urban design for the elderly, you improve the health for everyone. Imagine that just in a building, you build stairs in a safe way for the elderly people to navigate and to reduce their chance of a fall. That is going to be a benefit for everyone in that who uses those stairs. It won't be just a benefit for elderly population. So I think a focus on age-friendly cities, on healthy aging, will have many, many benefits that cut across all the life courses, going back to birth and conception even.
Indeed. So let's turn to your life, Gauden. What does a day in your life look like?
It's, I think I can reduce it to one word: meetings. So it's not just because we are in an era of Zoom, but where everyone is zooming around and going from one meeting to another, sometimes because of constraints related to disease control. But even in outside the virtual world, it is a series of meetings. It's meetings with partners and government, for example, currently discussing the country cooperation strategy. It's meetings within the UN and within WHO. One big project that is currently taking up a lot of my time is I'm coordinating something called an innovation forum for the Western Pacific region, where we have quite a number of Chinese innovators also making themselves known and present in showing their innovations to other member states in the Western Pacific. So all the practicalities of organizing such an event and bringing in keynote speakers, designing sessions and briefing them, so that our thesis, our task is that we can embrace what the economist Mariana Mazzucato has called mission economy, bringing the whole economy of a country around a mission for health for all. And so this innovation forum is inspired by the Western Pacific for the Future policy, where innovation in health is seen as an essential operational shift for all, and also inspired by the economic thinking that of mission economies that I have summarized very briefly. I meet stakeholders in academia, and I also, of course, have to be a manager. So one interesting experiment in these days where everyone is stressed, where numbers of meetings are limited, I am currently undergoing an experiment that I find I can recommend to every single manager that I know. I'm organizing something called the Listening Month, where I am having 1 hour a week, where I just 1 hour a day, which I devote to talking to a different member of my staff. And it is literally a listening month where I just open my ears, take out my notebook, and I am writing the notes and the advice, the observations that they give me. And there is no distinction. I speak to the IE as much as I speak to the most senior manager in the office. And I have to tell you, one learns a lot, both about people's experience of health, as well as ways about how the management of my own office could be conducted. So one tries to practice the creation of a healthy, safe, and respectful setting at the same time as one conducts all these other political meetings. I think that gives you a sense. Of course, there's the normal everyday business of managing the resources of the office that go naturally with being the head of an office such as ours.
Lovely. I mean, you obviously are a leader that has great empathy, and I think a lot of us can learn a lot from what you just told us. Hopefully, all the leadership of the UN, which will be listening to this podcast, may take back something from this message you've just given. At least I have taken something very important. Thank you for that, Gauden.
Thank you.
So tell us, what does delivering as one mean to you, Gauden?
It means, I think, shared vision, shared action. We are lucky to have the work cut out for us with Agenda 2030. We are all constrained by resources. It's not just financial resources, but also by, I think, two big resources are time, that we have only a limited number of hours, and attention. We can only keep a limited number of policy issues at the forefront. I myself find that I have to go from COVID to non-communicable disease, to aging, to road safety, to mental health, to salt reduction at the narrow level, or to broader health system. So there's enough, even within Sustainable Development Goal 3, to keep me extremely busy and to consume all my time and attention. So the fact of the existence of a UN country team, the occasional one-to-one collaborations, the participation in the understanding of a cooperation framework. Again, I renamed the 4 Ps: people and prosperity, planet and partnerships, that rise above individual, more programmatic work that we are consumed by on a daily basis, gives us a forum where a joint vision can be created as well as joint action. Any effort to pull out one SDG from the other 16 results in a connected hairball. There's so many lines in between that it is good to have a country team that is coordinated and understands each other's positions, and through mutual information becomes a vehicle for coordinated action. At some point also, one has to say, okay, yes, I might be very interested in nutrition, but there are other agencies, the Food and Agriculture, the World Food Programme, and any view of food has the components of food security, food quality, and food safety that are handled by different agencies. And one UN means that when we get together with our joint missions, we can see the food system in its entirety rather than just focusing on what might be narrower related to our own direct mission. Like, for example, I might focus on food quality more than the other two, but of course they can't be separated. So the one UN gives us both a forum where visions can be created together and sustained, and a vehicle for action.
Great. Which brings me to perhaps the most pertinent part of this conversation, is that what, in your expectations, Gauden, is an ideal resident coordinator?
Okay. Asked by the resident coordinator, that's a very nice and humble question. Thank you for actually raising it. An ideal resident coordinator is a good manager and a good teacher. And I don't mean that one or the other in the resident coordinator is not the direct manager of my work. I report to my regional director, but through the country team, I have to work with the resident coordinator as someone has to be the one who coordinates us. So two qualities that I like about a good manager and a good teacher, I often reflect now at this stage in my career, having worked, I don't want to count the number of decades. I look back and I see I have worked under umpteen managers, and in my student days, I had uncountable number of teachers. I remember the good managers and the good teachers had a distinction from the bad managers and the bad teachers, which I am sure we have had, unfortunately, experience of. The good manager is the one who makes you think you are doing things out of your own initiative, but in fact are creating the climate and the context within which you can work. The good teacher makes you think you are learning on your own, but is actually creating a pathway of learning that is tailored to yourself and letting you discover it. And I think those two qualities are two qualities that I try, rather than impose them on the resident coordinator, I try to bring into my own practice on a daily basis. And by extension, I project them onto my image of the ideal RC.
Thank you, Gauden. I think all the resident coordinators would also be listening to this, and I think it's a very important takeaway point: a good manager and a good teacher. Well, thank you very much, Gauden, for sharing your story and sharing your time with us today. If you would like to learn more, visit china.un.org or follow the UN in China on our Twitter. Join us next time for another installment of Delivering as One, a UN in China conversation. Thank you once again for joining us.
Thank you. Thank you.